come back to his own school with his team comprising of doctors. One is his own sister, Dr. Pooja, and Dr. Nancy, and one more person who helps her in the hospital. They have Dr.Aman Sachdeva's dental studio closer to Crystal Palace Hotel. And he's our ex-student. Today he has checked up from classes 12, 10, 11 and 12. He didn't have enough time because I hear some of you don't even brush, so he needs to educate you. So today he is with us. Let us welcome him with a loud applause. Dr.Aman feels shy. So you need to encourage now and then with a loud applause. He was very popular in the school. He's a good dancer, I believe. And also used to take female role in plays and things like that. So he did very well. The teachers appreciated him. And I can see that his growth has taken up so much. He's doing very well as a doctor. Let's once again appreciate him with a loud applause.
Thank you so much, and very good afternoon to all of you all here. And it's an honor for me to be standing in front of you all here and talking. And I'm a bit nervous too, seeing all you guys around here. But happy to be back in my school. Well, I would like to talk a little on the dental issues, what we are here for. Basically, I saw about, I think so about 200 students today. 10th class, 11th and 12th. So I would just like to say that it is an important part of our body and we should be taking care of it as we take care of other things. And what I believe that a lot of you feel that I don't have any pain means I don't have anything to do with my teeth. But you've got to keep looking into your oral cavity and figure out that you have any plaque discolorations or anything. Because when the cavity begins, you don't have any pain. So that's the time you can just take care of it in the initial stage. So if you delay it, then it goes deeper and the decay is more. And then eventually you'll have pain. So that's a bad time to go to the dentist. So precaution is always better than cure. So you can just take care of it initially in the initial stage. And I was very surprised to see a lot of students who were studying in dental school, they say they don't even brush. So my question was like, do you eat every day or do you take a shower every day? I guess everybody does. So it's very, very important. If you're getting late to school doesn't mean you don't brush it all the time. It's for your own self. And I'm sure like a lot of you must be like, okay, once in the morning you're brushing, it's good enough, but night it's okay, you take it easy, go to bed, sleep, one brush karega type, that kind of an attitude, right? So, but I think so it's very, very important because those 7-8 hours when you sleep at night is the main time for the bacteria to multiply. So if you brush at night, it's very, very important for you. I know it takes a little time in a routine to get into that, but still if you can follow that, it will be really, really good for your oral health. And I see a lot of kids having, all the students having irregularly placed teeth. And that is also one of the causes for having various discoloration on your tooth surfaces and at the same time, having decayed tooth because there are places which are not accessible by you yourself with the brush when you're brushing it. So it's important because in our country still dental education is not enough for the parents and for the children. So it's very, very important that you have a little idea about it, that all these things in foreign countries are taken care at regular intervals. Like if for somebody has to go for an orthodontic treatment, which is a treatment done for crooked teeth, you might call it malaligned teeth or something like that. You can get it done at an early stage and you have straight teeth all around. You look good, you look handsome. At the same time, you have a better oral hygiene as well because the accessibility to various areas get better for you. And I believe you should be visiting your dentist where, I think so, we guys also never used to do it unless and until we got educated about it. But we guys never used to visit the dentist also till the time we don't have any pain. That's the basic attitude everybody has in India. They feel that, okay, fine, I don't have pain, I don't need to visit the dentist. But if you can visit the dentist once in a year also, just for a normal checkup, it'll be great for you. See what happens right now at an early stage, as you guys are all young people here, you might not feel any difference, but as you grow, as time passes by, you have various things you have to go through. And I think so all of us living in this world do have good food, feel healthy. So teeth are the most essential part to enjoy our food, be healthy and everything. So it's very, very important you visit your dentist once in a year at least. I stress once. Normally they say 6 to 8 months, but once in a year. And there are a lot of myths I want to clarify to all the people present here. The myths are like, you get your tooth extracted and your eyesight is weak or something, and you get your teeth cleaned and they become brittle and they become weak. There is nothing like that. The point is that if there was something like that, we would not be allowed to do it as doctors or dentists. It would not be in the practice. So there's nothing to fear about, and you should always go in for the best for your health. And if you're going in for an extraction, you should know, in our books, it said these days a tooth in socket is a diamond in pocket. It's something similar to that. So we don't believe in pulling our teeth unless and until it's a condition which you caused to yourself, because you don't take care of it. So there are no myths like this that you get weak eyes. There's no myth where you get the teeth are getting brittle, nothing like that. And you should get your regular cleaning. I give all my patients a simple example when they come to me. They say, why should we get scaling done? Why should we get our teeth cleaned? It's a simple thing. Everybody nowadays own a car or a bike or something, right? But every day you clean your bike, you clean your car, you drive it, you take it around, but you still give it for a servicing. Yes, it's a similar way. You clean your teeth every day. You say, I have patients coming to me, they tell me, we brush twice daily, how come we've got BK2? How come we've got a problem with that? The problem is that there are certain areas where you don't have access, where we have access. It's something what I quoted the example, like you drive your car every day, you wash it every day, you brush your teeth every day, but you give your car for servicing after 6 months, 1 year or whatever time. It's a similar thing. You go to the dentist once in a year, get your scaling done, get your cleaning of the teeth done, and he can have a thorough look at your whole oral cavity, a holistic view of your oral cavity, where there is any problem, and it can be sorted at an initial stage. So I would just stress on one thing, that keep smiling and stay healthy. And it's been a pleasure being back in the school. Thank you to Father John Bosco for being such a sport. And thank you to all of you, all guys, to come out here and listen to me. And to all the staff, all the teachers. And may all of you do really, really well in this career. Thank you so much. Thank you.
Boys and teachers, in case you have any doubt, you can clarify. Doctor is available. You can ask him if you have any clarification, any questions to ask.